I'd like to talk about something now that's really important to me and a lot of the other surgeons down here in South Florida, and that's medical tourism. You may or may not know what medical tourism is, but let me just discuss it a little bit in detail, and then what the pros and cons are and what my philosophy is. So medical tourism is basically going to a location, a destination location, that you would go for vacation or holiday, but you have your surgery along the way. And people do it because of the vacation so that they can get their recovery time in, or they do it because they're saving money, or a combination of things. And as you can imagine, Miami is one of those destinations for medical tourism. And it's kind of interesting because we see a lot of complications from patients that go to medical tourism in other countries like Colombia or Venezuela or Brazil or Argentina. And what exactly do I feel about that? I mean, I know for a fact there are a lot of great surgeons in those countries. So going to another country or coming to Miami or going anywhere for your plastic surgery is not in and of itself wrong or dangerous, but you have to be careful. So you need to do your research on the surgeon, what their complication rate is, look at see what their other results are. You're happy with their aesthetic eye and the way that they do things. Read the reviews. And the second thing you need to factor in is recovery time and risk of complication. And to me, that's more important than anything. So even the best surgeon is going to have complications. And hopefully the rate is going to be much lower, but there's still a possibility of complications. And you don't want to have a complication with somebody that you're going to have a hard time getting back to seeing, because most surgeons don't want to take care of other surgeons' complications. And you don't want another surgeon to take care of that person's complications. You want the person who did the surgery to take care of you when there's a problem, because financially and for sake of continuity of care, that's going to be in your best interest. So I know a lot of people, they go to Brazil, but they have family there, so they can stay there for 2 weeks, a month, while they're recovering to make sure everything is healing properly. Same thing with Colombia or Argentina. But if you're coming from Kansas or Denver or Washington, D.C., and you're going to these countries and you don't have any friends or family there, it's going to be really hard for you to get back and see your surgeon. And this can even happen in the United States. I know people who have gone from wherever they live to California or New York or here to Miami, and then a complication develops and they're traveling back and forth, and it's incredibly frustrating. So just keep that in mind and really do your research when you pick your surgeon.